Hey guys, Dr. Zach here with Infinity Wellness Center in Aurora, Colorado. We're going to be talking about TMJ or TMJD, Temporomandibular Joint Dysfunction. So if you guys have ever dealt with jaw pain, potentially tension, headaches, neck discomfort, what we want to look at when we do an evaluation is how the jaw moves in this area. A lot of people will get shooting pains or clicking, grinding, or maybe the jaw as you open gets stuck. When we do the evaluation on the jaw, there's a couple of different things that we're going to be looking at. So we will put our fingers on the side of the jaw right here, and we'll have the patient open up their jaw and then close. Open and close. Open and close. Now when we do this, we want to make sure that the jaw joint actually opens up evenly on both sides and not one goes first and then the other one catches up to it. Make sure there's no popping or cracking when that's happening. Now when we do the adjustments to the jaw, we have a couple different instruments that we would utilize. The first one that we would be using it's called an activator. All right, now with the activator, we would find the jaw that is stuck and not moving very well, turn the patient's head to the side, and in this area here, we apply the tip of the arthrostem right at the tip of that joint, and we apply a little impulse there, between 1 to 3 impulses, to make sure that that joint opens back up again. All right, so that's the first instrument that we would be utilizing. The next one we would be utilizing is called an arthrostem. Now, with this arthrostem, would be very similar into the same little area here, but this one here sends multiple repetitive forces into that same area. So we would get into that same little joint, angle it down, hold for a couple seconds to get that joint moving again. All right. Now, lastly, we have a lot of patients, they will have jaw pain, but also they could have some tension in the temporal area right here, sometimes on the side, down in the masseter muscle right here. Now when that happens, you can use your fingers to try to massage that down to loosen up that muscle, do some massaging here as well. Or when you come into Infinity Wellness Center, we have this instrument called a rapid release tool. Now with this here, it's a massage instrument that turns on. It's pretty loud, but we would do that just very gently onto these muscles here. Then when we do that, what that's going to do is going to help to relax the muscles where it could be creating some tension and tightness into the jaw. We will do that on both sides to make sure that the jaw is even on both sides. Once we're done, we're going to reassess the jaw to make sure the jaw actually is opening up evenly, doesn't have that popping and cracking, the crepitus. So we're going to have the patient open the jaw again and relax, and open and relax, and open and relax. So when that happens, we can feel the jaw does evenly move side by side when he opens his mouth, and his mouth is in an open, good space as well. If you do have TMJ, any pain in the jaw, potentially some neck discomfort, give us a call at 720-747-5333.